हेलो फ्रेंड्स, वेलकम टू क्लासेस बाय लैब डॉक्टर। आज के क्लास में हम एल्बुमिन्यूरिया के बारे में जानेंगे। सो एल्बुमिन इन द यूरिन इज कॉल्ड एज albuminuria. So it is the abnormal loss of albumin in the urine, and albumin is also found in urine of healthy persons. But जो पेशेंट को किडनी प्रॉब्लम है उनमें ये ज्यादा क्वांटिटी में पाया जाता है. So whenever the albumin is less than 30 milligram per 24-hour urine, that is normal. So some amount of albumin is passed in healthy individuals also, but it should be less than 30 milligram per 24 hours. And the urine protein composition, you know that it contains 30% albumin, 30% globulin, and 40% would be a tissue protein or tam horsefall protein. So when I say proteinuria, it will have causes like either it could be because of glomerular dysfunction, glomerulus में कुछ problem है, या tubules में कुछ problem है. ग्लोमेरुलस डिसफंक्शन मतलब द ग्लोमेरुलर मेम्ब्रेन इंटीग्रिटी अफेक्ट हुआ है, एंड मेजॉरिटी ऑफ द टाइम जो 80% जो एल्बुमिन मिलता है दैट इज मेनली बिकॉज ऑफ ग्लोमेरुलर इंजुरी. अगर बेसमेंट मेम्ब्रेन में कुछ प्रॉब्लम है, एंडोथीलियम में कुछ प्रॉब्लम है, या पोडोसाइट्स में कुछ प्रॉब्लम है, यू विल गेट द glomerular injury which will lead to albuminuria. So 80% of albumin, if it is when we see it in the urine, it is mainly because of glomerular injury, which can happen due to diabetes, amyloidosis, collagen diseases, sick agents, or because of dysglobinemia. And tubular dysfunction में क्या होता है? There is no adequate reabsorption, so that leads to proteinuria, which can happen in alpha 1 microglobulinemia, beta microglobulinemia, etc. So when we say the degree of proteinuria, we tell it as mildly increased, moderately increased, and severely increased. See, अगर आप albuminuria या albumin to creatinine ratio देखोगे, in case of mildly increase you will always see, or whenever it is normal it is less than 30. Whenever it is moderately increased, we say when the albumin excretion is between 30 to 299 milligram, and when it is more than 300 milligram, it is severely increased. The same thing applies to proteinuria also. Like I've already told you, 24-hour protein excretion should be less than 150 milligram. अगर ये 150 to 499 milligrams हो जाता है, that means it is moderately increased, the proteinuria. And अगर if it is more than 500 milligram per 24 hours वो पास होता है, that means there is severe proteinuria. So sometimes we call it as microalbuminuria. Microalbuminuria matlab the quantity or the traces of albumin which is excreted is micro, that is it is around 30 to 300. Macro matlab zyada quantity. The macro doesn't refer to the size, it is the amount. So macro matlab agar 300 से ज़्यादा यूरिन में पास हो रहा है, then we call it as macroalbuminuria. And nephrotic range matlab agar the albumin excretion goes beyond 3500 milligrams per 24 hour, that is nephrotic range proteinuria, jo we see in case of nephrotic syndrome. So why albuminuria becomes important? Because albumin is the principal component of this urinary protein, which makes up to 30% of urinary proteins. The degree of albuminuria and cardiovascular disease का जो risk है, there is a correlation between these two, which we will see in the coming slides. But there is a correlation. अगर albuminuria होता रहता है और उस degree of albuminuria and the cardiovascular risk is closely associated. This albuminuria is more sensitive marker of changes in the glomerular permeability than the urinary total protein. Urinary total protein say albumin is a better marker. It's a more sensitive marker for the glomerular injury. And I have already told you urinary albumin is a more sensitive test, especially हमको ये glomerular pathology देखने के लिए whenever there are some systemic diseases like diabetes हो, hypertension hypertension हो या immune mediated renal disease हो, monitoring the level of albumin in the urine is much helpful rather than doing the urine total protein. And we can also classify the chronic kidney disease grades by the level of albuminuria. So this is an article wherein they have told the correlation between microalbuminuria and cardiovascular disease. So अगर microalbuminuria होता है, this may be a marker of chronic vascular disease risk because it reflects the subclinical vascular damage in the kidney and other vascular beds. It may also signify systemic endothelial dysfunction that predisposes to future cardiovascular events. इसका मतलब ये है कि हमने देखा था in our previous slides that the glomerular dysfunction, whenever there is a glomerular dysfunction, and that could be because of an endothelial injury or that could be basement membrane disruption, etc., there is albumin which is excreted. So अगर albumin urine में आता है तो we get an idea that this could be because of some damage to the glomerulus. It also tells us that there is some endothelial dysfunction या blood vessel में कोई dysfunction है. So that could happen in other parts of the body also, like in cases of your heart. So whenever there is albuminuria, it also brings up the possibility that हाँ patient को कोई heart problem भी हो सकता है क्योंकि वहाँ पे भी endothelial damage हो सकता है. दोनों के बीच में there are shared pathogenesis like hypertension है, patient को अगर BP है, patient को diabetes है, patient को obesity है, patient को chronic inflammation है, तो heart में भी वो damage करेगा and even kidney में भी damage करेगा. दोनों में अगर chronic inflammation है या तो hemodynamic alteration हो गया या तो oxidative stress हो गया, endothelial damage है तो दोनों organs खराब हो जाएंगे. So that is why they have come to a conclusion that this albuminuria can also indicate that the heart also could be at risk. So that is the correlation between albuminuria and cardiovascular risk. And also this is the same thing which is in the clinical trials. They have tried to find out albuminuria in heart failure also, and albuminuria as a risk marker for heart failure. And I have also told you that albuminuria can also be used to grade the chronic kidney disease. So here you can see these are the grades of the chronic kidney disease, wherein the EGFR is more than 90 in G1, and in kidney failure the EGFR has come to less than 15. And along with the albuminuria, wherein the mild which is less than 30, moderately which is 30 to 299, and severe when there is more than 300 milligram, you can decide the prognosis of the chronic kidney disease also along with albuminuria and the GFR. These are the normal ranges of albumin in the urine. The normal range should be less than 30 milligram per 24 hours. Suppose if it is between 30 to 299, we call it as microalbuminuria. Now it is better called as moderately increased, and suppose if it is more than 300 milligram, then we call it as macroalbuminuria or severely increased. And if the urinary albumin excretion rate, if it is more than 30 milligram per 24 hours and it is continuously like this for more than 3 months, it indicates a chronic kidney disease. So this also has to be remembered. So this is persistent albuminuria categories, category A1, A2 and A3, wherein in category A1 the albumin excretion is less than 30 milligram, and in A2 where is moderately increased it is between 30 to 299 milligram, and in severely increased cases it is more than 300 milligrams. So that is all about albuminuria. Remember, albuminuria is different from proteinuria. When I say proteinuria, it includes albumin also. When I say protein, it is albumin, globulin and the tissue proteins. When I say albuminuria, it is only the albumin which we are calculating. Usually when we see urine protein, that is the albumin which we are trying to find out, and it is a negative as in a normal range. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.